Daniel Lerman, the Medical Director of Sarcoma at Presbyterian St. Luke's Institution for Limb Preservation in combination with the Sarah Cannon Cancer Institute. Sarcoma can be a scary word. It's a cancer that starts in the musculoskeletal system, both the soft tissue and the bones that make up our skeleton. There are many different types of sarcomas. There are approximately 65 different types of soft tissue sarcomas and really 4 or 5 major types of bone-based sarcomas. These cancers are rare cancers. They represent less than 1% of solid cancers that grow in the adult population. Because of that, if somebody you know or love has been diagnosed with a sarcoma, it's imperative that they receive treatment at a sarcoma center, a place focused on sarcoma care. Sarcomas require some of the most advanced treatment that healthcare has to offer. They are a disease that requires multiple different doctors from different specialties working together to optimize the patient's outcome and chance of survival. Oftentimes, people with a sarcoma have a delay in diagnosis. The delay in diagnosis comes about through many different pathways. People can neglect a lump or a bump on their body. People can ignore or shoo away hip pain that they've had for a prolonged period of time. This delay in diagnosis can be problematic for certain patients who then present with a disease that is more advanced or more aggressive than what it may once have been. As a doc who takes care of patients with sarcoma, I inform all of my friends, all of my patients, and I ask of you to be cognizant of your body, be aware of what's going on. If you have a new lump or bump in a strange place, or if you have a mass that's enlarging, if you have pain that is persistent in an area, it's important to understand why it's there and not dismiss it out of hand of just saying, oh, that's a lipoma, or that's just hip pain. Sometimes they can represent a more insidious or aggressive disease. When somebody's diagnosed with a sarcoma, the next step is a process called staging. Staging means we screen the patient from head to toe to understand the extent of the disease. What stage somebody's cancer in is very much associated with the treatment options and ultimately their long-term prognosis. It is beneficial to find sarcomas earlier. However, there is no routine screening that is recommended because the disease process is so rare. But when diagnosed with a sarcoma and going through the staging process, it's important to have a team that involves a surgeon specialized in sarcoma, such as myself as an orthopedic oncologist, a medical oncologist, and a radiation oncologist. Really combines the primary cancer treatment care for sarcoma. Here at the Institute for Limb Preservation, we work with a multidisciplinary team that really allows us to achieve the best possible outcomes for our patients. Not only do we rely on those cancer specialists, surgical intervention, medical oncologists, and radiation oncologists, but we also rely on specialists who are focused on patients' function and outcomes, such as our plastic reconstructive surgeon, who optimizes patients around the time of surgery if a large muscle needs to be resected and removed. We work closely with a group called Oncology Rehab, which is a group of physical therapists focused on the care of cancer patients. As you can imagine, somebody who's gone through a large cancer surgery and radiation and care and are going through rehab is a very different patient population than, say, somebody who's had an ACL tear and reconstruction. It is the knowledge that our oncology rehab colleagues have that really allow our patients to shine from a physical perspective in the post-operative period. Additionally, through the Sarah Cannon Cancer Network, we have a nurse navigator who is dedicated to our patients, helping them through the process of the cancer diagnosis, staging, and treatment. It all is certainly overwhelming. And when somebody is informed about their cancer, their whole world gets redefined and their head is spinning. It is critical to have somebody who can really hold your hand and literally help you through the process of having the disease diagnosed, understood, and managed. Our navigator, Mary McCormick, is really the crown jewel in our cancer care team.
Here at Presbyterian St. Luke's, we have a multidisciplinary team with multiple physicians with medical oncology, radiation oncology, our surgeons. And so it's critical for a patient to have all the resources that they need. We do treat a lot of patients from out of town or out of state, so it's critical for us to make sure that the patients have housing, lodging, transportation while they're here. We work with the patients to make sure that they're covered all the way around, mentally, physically, emotionally. And it's really important to kind of handhold the patient through the process and just make sure that they know that they have a consistent person with them along the side of their journey to make sure that they have all of the tools that they need.
Here at the Institute for Limb Preservation, we understand the anxiety and the fear that comes up around any oncologic diagnosis. Sarcoma, being a rare disease, has the opportunity to create even more kind of frustration and fear due to the lack of information out there and people's lack of knowledge about it in general. We're a resource here for patients, for their docs, and we're always available. We provide high-level sarcoma care on a daily basis. We understand what it's like to be a new patient. We understand what it's like to be under treatment and to have gone through that process. And we are here to do that for you on a daily basis.